The Palestinian resistance announced the names of 3 hostages that will be released in the latest batch as part of the ceasefire agreement. The office of Israeli Prime Minister Benjamin Netanyahu confirmed that it had received the names of the 3 detainees scheduled to be released. The Israeli army announced that it had received 8 detainees, including 3 Israelis and 5 foreigners. Israeli media reported that Rafah crossing linking to the Gaza Strip to Egypt will reopen today, as was scheduled in the ceasefire agreement. The Jerusalem Post reported that 50 wounded Palestinians will leave the Strip through the Rafah crossing after receiving security approval from the General Security Service. The Rafah crossing has been closed for months since the Israeli army expanded its war on Gaza to the southern part of the Strip and the border city of Rafah last year. UN Secretary General called for the immediate evacuation of 2,500 children from the Gaza Strip for medical treatment. Doctors had volunteered in Gaza during the 15-month war, which devastated the enclave of more than 2 million people and its healthcare system. Just days before a ceasefire began, the World Health Organization said more than 12,000 patients were awaiting medical evacuation, and it hoped the number would rise during the ceasefire. The UNRWA said that any forced cessation of its work in Gaza would undermine the ceasefire. UNRWA's Director of Communications and Public Information warned during a press conference in Geneva that the very fragile ceasefire would be jeopardized if UNRWA was not allowed to continue bringing in and distributing supplies. The director added that the agency's work in Gaza and elsewhere was continuing despite the Israeli ban that was supposed to go into effect on Thursday. Britain, France, and Germany reiterated their grave concern over Israeli implementing a law forbidding any contact between its officials and UN Palestinian Relief Agency, UNRWA. The 3 countries also asked the Israeli occupation government to abide by its international obligations and live up to its responsibility to ensure full, rapid, safe, and unhindered humanitarian assistance and the provision of basic services to the civilian population.